The achievements of outstanding eye care professionals, low vision specialists and volunteers were recognised at our annual conference in London. The winners of our Awards for Excellence 2014 were announced after the Society was once again inundated with nominations. Winners of the Clinical Service of the Year category were Mrs Geeta Menon and the Macular Service at Frimley Park Hospital, Mr Andrew Needham and his team at Eye Care Medical in Macclesfield, and Mr Paul Tesher and the Macular Service at Lincoln County Hospital. Jeremy Parks and Lisa Evans were named Optometrists of the Year after patients praised their approach. Susan Davies was named Support and Rehabilitation Professional of the Year but was unable to collect her award. The work of the Society's support groups were highlighted in the Chairman's Award for volunteering. Daphne Dorman from Oxford, Jean Kemp from Hull and Leonard Sharp from Boston are all volunteers at our support groups in their local areas. Finally, consultant ophthalmologist Sarah Lucy Watson from the Royal Berkshire Hospital won the Alan Alderman Award for services to people with macular conditions. Miss Watson said she was delighted and honoured to accept the award on behalf of her team.
You're all aware of the increasing numbers of patients who need assessment and treatment and support with central sight impairment, so we're striving to provide a high-quality service with kindness and compassion. My role is to be aware of the new research and to provide best treatments for individuals, but we are indebted to the support of the Macular Society for provision of information and education material for patients and families, and for local, practical and moral support for our patients outside the hospital setting. So it's great to be able to work in partnership with such an effective and successful organisation. Thank you for your support.
Thank you.
I felt really proud and honoured to win the award. It was really nice that a patient at the time of trouble to nominate me. I think one of the most important aspects is I visit all my low vision patients as a domiciliary, because when you're in a professional practice it's very bright, it's ideal room conditions for reading. Patients' homes aren't like that. They could very often can be very dim, especially in the South Wales valleys where I work. There are a lot of terraced houses which have got poor lighting, not many windows. So to advise people on the lighting aspect as well as the magnifier side and the optometric side is really important.
I was thrilled, absolutely thrilled. It's a tremendous honour. I just feel that it's something that's very important because there's not a lot of support for people with macular disease, and well, it's just something that I feel sort of called to be able to do, because I'm retired now and I do have the time, so it's nice to be able to help people where I can.
Oh, I was elated. It was fantastic. Best feeling ever. You know, we were just whooping in the clinic and the patients picked up on it and they were really delighted too. It's just excellent. It's just brilliant feeling. And it just, you know, we were so pleased that the patients appreciated all the effort and time and everything that's gone into it, because that's the best accolade you can have, basically. I think the thing is to make sure you see the patients rapidly, get them in and make sure you get treatment in rapidly, explain what you're going to do, and then to make sure you don't have long waits in the clinic too, because our average waiting time is just over an hour for a review appointment, but if they need a treatment it's about half an hour more than that, so about an hour and a half. And the patients and the carers who have to come with the patients really appreciate that you're seeing them quickly and you know, they're in and out quickly. The other thing we have is a free car parking facility and quite a large number of car parking spaces too, about 34. Plus we also have disabled facilities too. So patients, you know, we've got widened doors, we've got disabled toilets. So we've kind of put a lot of thought into that as well. So I think patients appreciate that too. Plus they also appreciate just seeing consistent doctors too. We've mainly got senior staff, so they're aware of the patient, they know the patient, they've seen them many times, and so hopefully we make good decisions, you know, and consistent decisions too.